Good evening all, and in this video I will talk about toning and or stimulating cranial nerve 10 exercises and or practices, and there are many. This nerve, as you now know, is the longest nerve in your body, so by working with different parts of your body, you will be affecting this nerve and therefore the functioning of autonomic nervous system, because it comprises 80% of it. Some of the basic ways are outlined on the web already, and there are many different practitioners and different therapies that could be utilized to help tone the vagus nerve, to keep it healthy. But I'll just describe the simplest ways to do it, and these include, of course, the first thing, the easiest thing is breathing. Breath work is how you access the vagus that innervates your diaphragm, your lungs, and the muscles around your torso. And in one of the earliest videos, I actually talked about how just taking calming breath to depress the diaphragm muscle already calms the vagus and puts you in a parasympathetic, relaxed state of nervous system. I would want to say here that many practices encourage you to do deep breathing, and that actually can be counterproductive and received by your nervous system as you going into some kind of dangerous situation, and will make you more mobilized, put you in a sympathetic state. So just breathing at a normal rate and depressing the diaphragm so it lowers actually is enough. Making any kinds of sounds that involve vocal cords and deep resonating of a sound going down into your chest cavity and perhaps top of the abdominal cavity, such as sound. Humming will probably produce the same effect. Listening to calming music, massage, even light massage. Remember that vagus also allows you to just get in touch with it if you gently touch the skin behind your ears and this part of your neck. You could even put your hand there lightly, but only one side at a time, so you don't occlude the blood supply to the head. And as you just lean into it gently, feel your sternocleidomastoid muscle, and feel how your body just relaxes and your breathing normalizes. So this is one of the things you can also do. On the back of your head, if you touch in that groove where your spine connects to the cranium, if you just keep your fingers there, just 2 fingers, and feel that nudge where your skull bone ends and your spine begins, and sit with that. It is very easy to do as well. Just notice what happens as you do this. Washing your face with cool water is another way to stimulate, tone the vagus. And of course, other practices that probably are done outside of the house, but could be in the house if you're already doing it, such as yoga and stretching, especially working with the psoas muscle that I will devote a video to, doing yoga, tai chi, any kind of like movement. You could also hugging self if you don't have anyone else, and putting your hands down on the edges of your rib cage here works to relax. So these are just some of the things you could do. There are more serious cases where people have conditions such as dysautonomia, and they might require stimulator being put inside their body to regulate the function of the vagus nerve. So the implants been done a very long time ago, but it's quite invasive. There are now different modalities to work with the vagus, such as safe and sound protocol, and that is a type of a sound therapy that just basically affects the vagus by affecting the vestibular branch, and I will make a separate video about that as well, especially because there's been many concerns raised with use of this type of therapy, and I perhaps might dispel some of the things for people if you would like to know. So this is going to be it for today's video. I will make another video, or series of videos rather, related to the functioning of the vagus and regulating our nervous system by regulating the vagus. If you have any questions, concerns, or comments, please don't hesitate to reach out. Thank you and have a good evening.